Start.
Okay, good morning everyone. Today, me and Al-Kadi, we are talking about the case, the patient's suicide attempt, ethical dilemma. In this case, we talk about nursing care for a terminal ill prostate cancer patients who express suicidal intention and ask the nurse to keep it confidential. Uh, the next, please. The concept theoretical framework. The patient is Mr. Green. He has 57 age and has terminal prostate cancer. And he expressed intent to commit suicide and requests confidentiality. The nurse dilemma is maintaining confidentiality and respect Mr. Green autonomy and disclose information prevent potential harm by altering the healthcare team. About ethical principles, autonomy, Mr. Green's right to make a decision, including his life, ending his life. However, safety risk may override this right. Beneficence, nurse duty to act Mr. Green's best interest, which may involve reporting his suicide plan, and no maleficence, obligation to prevent harm, and maintaining confidentiality could facilitate harm. Next, please. About ethical theory, we can also see utilitarianism in this case. Disclosing the plan benefits Mr. Green, his family, and the healthcare team by ensuring his safety. We can also see deontology, duty to protect life and prevent harm justifies breaching confidentiality. And the last, nurse codes of ethics, the guidance, the Australian Nurse Code of Ethics support disclosure in life-threatening situation to prioritize safety, patient safety over confidentiality. Okay, so now I pass.
Okay, good afternoon to you all. I am going to proceed from where my co-presenter stops. So as he rightly mentioned, that we are looking at ethical dilemma in a health facility whereby the nurses faced most of the time these ethical dilemmas in their work. Because normally what happens is they would have a case whereby they would have to choose either choices and it becomes difficult for them. So in this case, the nurses, in the Mr. Green's case, the nurses face a particular ethical dilemma, and then my co-presenter has talked about the theories and also the ethical principles. So I am going to proceed from the application of the theoretical framework. So for the theory of autonomy, so it says it is the right to make informed decisions, the right of the patients to make informed decisions about their care without external influence. So the patients have their right to make a decision based on their life, so without any other person influencing their decision. So respecting Mr. Green's autonomy means maintaining his confidentiality. So in this case, the nurse was in the dilemma of whether to disclose the intention of the patient of committing suicide or to keep it to himself, keep it as a secret. So for him, Mr. Green's autonomy means maintaining his confidentiality, that is keeping it as a secret without disclosing it to other patients. So, however, this could lead to significant harm if it prevents necessary intervention. So, if Mr. Green's intention to commit suicide is being hidden, that could lead to a very, very serious problem or danger, because Mr. Green is going to lose his life, which is going to be a problem for him. So, beneficence, the theory of beneficence, it means the definition is ethical obligation to act in the best interest of the patient, promoting their well-being. So beneficence here means the nurses has to act in the best interest of the patient. So here, the best interest of the patient is to do what? Is to disclose it to prevent the suicide. So that is the theory. So how is this theory applied? He said the nurse must evaluate if maintaining confidentiality truly serves Mr. Green's best interest. Disclosing his suicidal intentions may lead to interventions that reduce his risk. So for the theory to be applied here, the nurse has to maintain what they have to critically analyze the situation and know which one exactly is better for Mr. Green. Because if Mr. Green's intention is being disclosed, that might reduce the risk of him committing a suicide. So from there, we also have the non-maleficence theory. So definition, principles of do no harm, guiding healthcare professionals to avoid actions that could harm patients. So this theory is one of the theories that normally guides healthcare personnel, because healthcare personnel are in a very, very critical situation within the economy or within the country or nations, for instance. So they have to do what? They have to maintain ethical responsibilities. They have to make sure that their behaviors or actions does not cause any harm within the health facilities. So how is that theory applied? We said the nurse has a duty to prevent harm. Maintaining confidentiality could allow Mr. Green to harm himself, necessitating disclosure to prioritize his safety. Yeah, because the nurses has this, the dilemma is the nurses are whether to disclose Mr. Green's intention to commit a suicide or to keep it as a confidentiality. But here, for this theory to be applied, they must disclose this to the healthcare personnel, because that is what is going to reduce the risk of Mr. Green's committing a suicide. If it is kept a secret or a confidentiality, then that means Mr. Green is going to harm himself. So, application of the ethical theories, we have utilitarianism is another theory. We say disclosure provides a net benefit to Mr. Green, his family, and healthcare providers, allowing for necessary support and intervention. For utilitarianism is whereby the actions or decisions made of the benefits of the general people, that is the largest number of people benefit from those decisions. So here, for Mr. Green's case, if his intention to commit suicide is being disclosed by the health personnel, now Mr. Green himself, his family, and also the healthcare personnel can do what? The healthcare providers can allow or can benefit from it. Because for the healthcare personnel, if they allow Mr. Green to commit suicide, that means they could face, the full force of the law. They could be jailed because of that. Because the nurses were aware, one of the nurses was aware of his intention. So if it is kept a secret and he ended up committing a suicide, that can lead to him being jailed. So from there we have the Nursing Code of Ethics, like guidance. The Australian National Code emphasizes respecting patients' autonomy while ensuring safety. Nurses must act when patients' decisions will lead to significant harm, supporting the disclosure of Mr. Green's intention. So for the patient, it is not only these ethical theories that are guiding them, but also the nursing codes of ethics. So in the Australian government, they have the National Code of Ethics that emphasizing respecting patients' autonomy, like their decisions must be respected. But those decisions that patients normally make should not be harmful to them. So if the decision made by the patient is harmful or is going to harm the general well-being of the patient, so it's better to do what? To apply these codes of ethics so that you can prevent the harm. So the key takeaways from this theory or from this case study is ethical dilemma. So in this case, there is an ethical dilemma. The case of Mr. Green required the nurses to choose between maintaining patients' confidentiality and preventing harm by disclosing a planned suicide pattern. So the ethical dilemma in this case is whether the patients should disclose Mr. Green's intention to commit suicide or to keep it as a confidence. So that is the ethical dilemma there. So the key principles we said: analysis of autonomy, beneficent and non-maleficent, alongside utilitarian and the ontology theory. So professional framework, we have the Australian Code of Ethics of Nurses guided the decisions to prioritize patient safety over confidentiality. That is the Australian Nursing Code of Ethics. They also prioritize safety, patient safety over their confidentiality. So balancing obligations. So the nurses also have to do what they have to balance their obligations, or they have to balance their duties. The nurses' decisions to disclose reflects a careful balance between respecting autonomy and the duty to prevent harm. Because nurses or health personnel, their duty is to prevent harm. So here they have to balance the autonomy of the patients and also their duty to prevent harm. So the autonomy of the patients should not allow them to cause harm in the health facility. So protection of life, the findings support the notion that protecting life often outweighs the obligation of confidentiality, especially when mental capacity is impaired. So that is also another findings that we are able to see from the report. So these are the references we have. So all and all talks about the ethical dilemma that is found in the case, and also the theoretical frameworks and the ethical theories that are used in the case. So these are our references. So we thank you all for your kind attention.